business will receive to help them provide health insurance for their employees. This will make health care more affordable for small businesses and their workers, enabling small business owners to reinvest more in their businesses. And this is what I intend to do once health insurance reform comes to pass. Before ending my remarks, I'd like to talk about another more personal reason for my support of health care reform. Yes, I am here today with my wife and as a small business owner, and I'm here as a father of a child with special needs that my wife and I have taken care of for 12 years. He's on the autism spectrum, and my insurance company does not cover any expenses for autism treatment, as do any of the other insurance companies in Virginia.
Take them out.
And they do spend a lot of money lobbying against coverage of autism services, and he does not receive coverage for speech therapy, which we have spent thousands of dollars on through the years out of pocket. And when I go to the public schools, or the public school where my son attends, I see these other children who can't afford these expensive services, and they are desperately needed. And I can't help but think our healthcare system is broken and it must change now. It's both morally bad and economically wasteful to withhold therapies that can enable people with autism to become gainfully employed, tax-paying citizens. Health insurance reform, even those that may oppose Obama's policies, I know care about health insurance reform, or at least they should. And as you undoubtedly remember from our grassroots work on President Obama's campaign, individuals working together for a common cause can be profoundly powerful. Thank you for joining with me in committing to fight for healthcare reform now, and in educating our legislators, especially Mark Warner, that being business-friendly means holding private insurers accountable for truly competitive choices, including a public healthcare option. Together we can make it happen. Let's get it done.
Thank you so much, Rob. I really appreciate those remarks. As Rob mentioned, a lot of folks have been out doing the grassroots work and having one-to-one conversations and group conversations about the need for health insurance reform in their own communities. Part of what those of us who worked as part of the President's campaign won in November was the ability to take these conversations outside of the Beltway and into public squares just like this, and out to farmers markets and around kitchen tables and living rooms all across this country and right here in Virginia. So what I'd like to do next is introduce a set of 3 Virginians who have been out doing that work to talk a little bit more about exactly what Organizing for America volunteers have been doing and what it is that we have to present today to Senator Warner's state director, who has been so kind to join us. So I'd like to introduce looking at my wrong note, Beth Kimbrio. And Megan Maher. And I'd also see if we can create a little space for Eva Hardy to come on.
Beth Kimbrio, I'm on the ground volunteering to get health care insurance reform passed. We have been canvassing door to door and in high traffic areas. We've been phone banking. Those phone bankers are here, a lot of them. Raise your hand if you've been phone banking. Thank you. I am also here involved in health insurance reform for a very personal reason. I also, like Lisa, am one of those people who have been deemed by the insurance industry as being uninsurable. Also, I have a daughter who is going to be graduating from college in 2 years, and she also has a medical condition, and without a public option, she will be uninsurable. We have been working very, very hard for many months, all summer long, collecting support and educating people about the President's 3 principles. And I want to introduce to you Kiana Connor, who also has been working on the ground here in Richmond.
Everyone, as Beth said, my name is Kiana Connor, and the reason why I'm involved with OFA, I'm a graduate student who got involved with politics for the first time in the Obama campaign. In the face of all odds, people said that we could not do it. He was unelectable. It couldn't happen. We did, and we did it well. Yesterday I turned 25 and I aged off of my parents' insurance and I can no longer afford it myself. So I'm back again to say yes we can and yes we will get health care reform this year. So let's keep calling, let's keep knocking, and let's do what we have to do to make sure that it happens. And next is Megan Mihar. She started Greater Richmond for Obama. She got us rolling a long time ago, and she's still sticking with us until we see it through.
Thanks. Hi, everyone. Like Kiana said, my name is Megan Maher, and I live right here in Richmond in the Fan, and I work full-time as an artist at a small art publishing company. And even though I do work full-time, I've been out there if I have a free evening, if I have a free weekend, making phone calls for health insurance reform. I've been going to the farmers markets and collecting some of the signatures that we're going to be presenting. And I just wanted to say, you know, the one reason why I'm out there doing this is that I believe in affordable health insurance for all Americans.
Thank you, Kiana. Thank you. Thank you, Megan. And now we want to present to Senator Warner's state director over, or I think about 42,000 declarations for support of the President's 3 principles that we have collected over the summer. And we hope that you will take this to Washington, that the senator will take this to Washington and know that we have his back if he will support the 3 principles. Thank you so much.
Thank you all. No, it's not true that people were tired after the last election. There's a lot of energy here, and you've got to keep that energy going. I just want you to know that I'm personally going to take those to Washington myself. I go up once a week because I don't want to, let things kind of go through a process up there where they may never get seen. I take them right to the folks who are working on health care, and they do read everything. So I just want you to know this is not an exercise in futility. It's something very meaningful that you're doing. It's something that we take very seriously. We have gotten over 80,000 pieces of mail, emails, phone calls in our state offices and Washington office on health care alone. Health care alone. There are a lot of different sides to it. There are some people that want a piece of this or some of that, or but all of us know that the current system is not fiscally sustainable going forward. So thank you all very, very much. We will work hard, and hopefully we will see that some results that will benefit so many people right now who do not have an opportunity to have any kind of coverage at all. Thank you.